outbreak confirmed at a youth facility in Carroll County. The Office of the Public Defender Juvenile Protection Division is calling for all children in custody to be tested. WMAR 2 News' Abby Isaacs joins us now from the Baltimore City Juvenile Justice Center to explain.
Over half of the Maryland Department of Juvenile Services facilities have had youth, staff, or both test positive for COVID-19. The current protocol is to test only symptomatic people, but some attorneys say that's not good enough. The Office of the Public Defender Juvenile Protection Division is calling for the Department of Juvenile Services to test all 192 youth in its care to stop the spread of COVID-19.
Given that the first child in Baltimore died of coronavirus earlier this week, a 15-year-old young woman, we are very concerned that when you don't do universal testing, when corona does come into a facility, it moves like wildfire.
Like what happened at the privately run detention center Silver Oak Academy in Carroll County, where an outbreak was confirmed last week. Chief Attorney Jenny Egan says they've raised concerns twice to DJS about the facility's insufficient COVID-19 response after hearing from the young people living there.
They were still holding hands or being forced to hold hands and told to hold hands at the sort of opening and closing of every day. You know, everyone stands in a circle and hold hands. That they were continuing to play contact sports where everyone was touching.
Silver Oak Academy said in a statement they followed CDC guidelines for social distancing, and the first staff member and student tested positive last week, prompting universal testing on Friday, resulting in 41 positive cases. They say the majority of the positive cases did not have symptoms, which worries Egan because right now, DJS is only testing youth with symptoms.
Our concern is that DJS continues to treat kids, or rather than testing them, with solitary confinement. Solitary confinement will cause lifelong harm in some of the young people who are experiencing it. They are extremely distressed. They are going into mental health crises.
The Secretary of DJS responded in a letter to the Office of the Public Defender late this afternoon, saying they'll continue to follow guidance from health experts, and proactive infection control is more important than universal testing, which includes the isolation of positive patients. He also said universal testing was needed at Silver Oak Academy because they were inconsistent in implementing mask and social distancing protocols. And if circumstances like those are replicated at a DJS facility, they'll consider testing everyone. The Office of the Public Defender would also like to see the couple hundred youth committed to DJS but placed in other public or private facilities tested as well. In Baltimore, Abby Isaacs, WMAR 2 News.